Hello friends. So today we are going to discuss about Gardner's syndrome. I've collected some 12 to 15 points for you to write well in your examinations. So let's get started. The first point is that it is a rare disorder and it is inherited as autosomal dominant trait. Our second point is it is due to a single pleiotropic gene. And what do we mean by pleiotropic gene? A pleiotropic gene is a gene that exhibits multiple phenotypic manifestations. The gene is located on the long arm of chromosome 5 and the gene is identified as adenomatous polyposis coli, that is APC tumor suppressor gene. So till now we have done the introduction part, that it is a rare disorder inherited as autosomal dominant trait and it is due to a single pleiotropic gene, and the gene is located on the long arm of chromosome 5 and it is identified as adenomatous polyposis coli APC tumor suppressor gene. So moving on to the clinical feature, we first see that there occurs multiple polyposis in the large intestine. What do we mean by polyposis? There will be many polyps inside the large intestine. As you can see here, there are many polyposis in the large intestine. Our second point is there will be osteomas of the bone, particularly of the long bones, the skull and the jaws. What do we mean by osteomas? Omas means tumor and osteomas means tumor of the bone. So there will be osteomas of bone. As you can see here, there is an osteoma in the jaw. Moving on, there will be multiple epidermoid cyst. Epidermoid cyst is also known as sebaceous cyst. So multiple epidermoid cyst will occur particularly on the scalp and on the back. Here you can see multiple epidermoid cyst on the back. Our fourth point is there will be occasional appearance of desmoid tumors. See here, it is a desmoid tumor. The next point is the oral manifestation of the Gardner syndrome. Here there will be impacted supernumerary and permanent teeth. A very important point of Gardner syndrome is there will be pigmented lesion in ocular fundus. Means there will be pigmented lesion in the eye fundus, and it is a very important point. So here we can see a pigmented lesion in the ocular fundus. See the intestinal polyps that occurred in the large intestine that can undergo malignant transformation to form adenocarcinomas. And what do we mean by adenocarcinoma? Carcinoma, as you know, is the malignancy. So adenocarcinoma is the malignancy of the mucus secreting glands. So the intestinal polyps will undergo malignant transformation into adenocarcinomas. And a very serious complication of the Gardner syndrome can be presence of thyroid, means occurrence of thyroid cancer. Now moving on to the treatment. See, when there will be malignant transformation of the bowel polyps to adenocarcinoma, it will be a major problem. And the treatment will require prophylactic colectomy. Colectomy, as you know, the surgical removal of some part of the colon. So prophylactic colectomy. The second treatment option is removal of jaw osteomas and epidermoid cysts, and this will occur because of cosmetic reason. So obviously, when when a patient will have jaws tumors and epidermoid cyst, it will not look good. So removal of jaws tumors and epidermoid cyst uh, uh, has to be done. Now the long-term prognosis will depend upon the behavior of the bowel adenocarcinomas. So with this we have come to the end of our video. Hope you like this video and write well in your examinations. So goodbye.